we could probably do a multiple podcasts about how we're brought up as women to view our bodies, how we view our right to have pleasure. There are layers upon layers in most of us when it comes to how we view our own sexual health and what that means. So, from that nurse practitioner standpoint, what is sexual health?
For me, sexual health is talking about libido, sex drive, lack of sex drive, orgasm, arousal, pain with sex, all those types of things. Of course, if you're, talking to somebody who takes care of younger patients, a lot of times it's more focused on like sexually transmitted infections and
Mm.
birth control. But obviously, we really need more of that part about pleasure and things like that.
I'm Jessica Vallant. I'm a physical therapist, women's health expert, and Pilates teacher, and my goal is to help all women feel strong, safe, and secure in their bodies. In this podcast, I'll share expert advice, facts, amazing guests, stories, compassion, and hope to help you meet your body in all seasons of life. I am so excited about this talk today, you guys. I've been waiting to bring you the right expert, and she is here today. We are talking all about sexual health and specifically sexual health as we age. We are talking about why our sexual health changes as we age. We are talking about ability to orgasm. We're talking about pain with sex and specific things that you can do about it. Let me tell you about Andrea. Andrea Martin has been a board certified women's health nurse practitioner since 2015 and earned her doctorate in nursing in 2018. She has spent most of her career focusing on pelvic floor disorders, the menopause transition, and sexual health. She's an active member of the International Society for the Study of Women's Sexual Health and most recently opened her own telemedicine practice called Glow Health, serving patients in Pennsylvania, New Jersey, and Maryland. In her free time, she enjoys aggressively spoiling her rescue pets and cross-stitching nerdy medical humor designs. She has an amazing and accessible Instagram where she educates over there and a great website, and I'm going to have the links to both below. I truly love this conversation. Please know there's just a couple cuss words that come out as we're talking very openly about this subject. It is open, it is vulnerable, it is fun, and I am so happy to bring you Andrea Martin today. Hi, everybody. Welcome back to Meet Your Body. I don't think there are words to describe how excited I am for this conversation today. And sometimes I feel like I bring guests on just for my own personal use. And I just use the excuse of, oh, look, I have a platform, but really I'm getting my own session. That's how I feel a little bit today. So, you guys heard the introduction. I introduced you to Andrea, but Andrea, thank you so much for being here today.
Thank you. We're
Yeah.
going to have so much fun today.
Oh, it's going to be so much fun. So, I want to start, just tell everybody your story, like as high level as you want or as detailed as you want, but tell us your story, where you are, and like the space that you like to hold in the world.
Sure. So I'm a women's health nurse practitioner. I actually started out my entire life plan was I was going to be a veterinarian.
Oh,
And
wow.
then in school quickly realized that like dogs and cats don't come to you because they're having a good day. They're coming
Oh,
because they're in pain and terrible things are happening. And I was like, I am not cut out for this. Somehow managed to switch to the nursing world, which I don't know what that says about me, but
yeah.
I love it. I've been a women's health nurse practitioner since 2015, maybe. I've worked in family planning clinics, urogynecology, sex medicine, pelvic pain, all the menopause things, and recently opened up my own little practice, my virtual telemedicine practice called Glow Health, where I'll be doing all the things menopause, perimenopause, sexual health virtually for patients in Pennsylvania, New Jersey, and Maryland.
That's amazing. And I was just on the site this morning. It truly is beautiful. Congratulations. And I
Thank you.
know I'm going to have these questions off the bat and we can talk about it more at the end,
hmm
but I know you're licensed in those three states. Can you also do any virtual sessions with people not in those states if you're not providing medical care, but just like as a consult?
Yeah, so we could do like an educational
Yep.
consult where obviously I can't prescribe to you.
Yep.
I can't, say, oh, you should stop this medicine, start this medicine, but kind of a general educational thing of like these are options that may be open to you.
Yes.
Maybe, here's a plan. Here's what I would say to your clinician and go from there.
No, that's perfect. So, guys, we'll have the links to all of that in the show notes and in the description, and we can talk about it more at the end. I would love to know what got you into this field. Like, did you know women's health was the field you wanted to go to, and then specifically sexual health when you started, or was it a long, windy road to get there?
I have a terrible habit of seeing something that I'm interested in, but automatically just thinking like, well, I could never do that. And that's not an option for me. Like I remember seeing stuff about like sexologists and all that and being like, wow, what a cool job. Like, too bad I'll never get to be in that field. So even women's health, it didn't click to me when I initially went back to school to become a nurse practitioner. Our first class that specified women, I kept staying late after class and
Mm,
asking all these questions. And I remember my teacher, who's a midwife, she was like,
mm,
"Why aren't you doing women's health?" And I was like, "I don't know." I
yeah.
don't have a good answer for you. And I was like, well, I guess I haven't done that specifically yet. So I'm really not qualified. And she was like, listen, before I became a midwife, the only vagina I ever saw was my own. She's like, if I could do this, you could do that. And that night I was like, I'm doing it. For women's health. Here we are.
Yeah.
And I truly love it. And as I kind of go along and evolve, everything that I do or learn about, it's very much inspired by patients. What
Mm,
need do they have that is not being met? And I very much take that. I'm like, well, this is my responsibility now because I don't have anyone to refer them to. Nobody's giving them good advice. So I gotta do it. And it
yeah.
always turns into something that I am so passionate about. And I love the more I learn about it, the more I become obsessed about learning about it. So big shout out to my patients.
Yeah. Yeah.
Even
Always, right? Yes. I know
yes,
they're our
yes.
biggest teachers. I mean, they're absolutely our biggest teachers.
Truly are, truly are.
All right, tell us this. I'm going to start like very high level. First, how would you describe, define, explain sexual health? I feel like we need to start there because we could probably do a whole multiple podcasts about culturally, right? How we're brought up as women to view our bodies, pleasure, how we view our right to have pleasure. I mean, all of that. Like there are layers upon layers in most of us as women when it comes to how we view our own sexual health and what that means. So, from that nurse practitioner standpoint, what is sexual health?
That is a great question. And I think some of that answer is going to vary based upon who you're talking to. For
Mm,
me, sexual health is talking about libido, sex drive, lack of sex drive,
mhm,
orgasm, arousal, pain with sex, all those types of things. Of course, if you're, talking to somebody who takes care of younger patients, a lot of times it's more
yeah,
focused on like sexually transmitted infections and
mm,
birth control. But obviously, we really need more of that part about pleasure and things like that. So I do think there can be a little bit of variability depending on who you're talking to.
yes. And then would you include, just because I want everyone to kind of
Hmm.
like get your mind in the right place as we're talking about this, do you also talk about self pleasure, masturbation, those kind of things under that umbrella?
Yeah.
Okay.
Sex is sex. We tend to think of sex as like it is only when a penis goes into a vagina
Yeah.
multiple times. And
Yep.
it's like, no, sex can be masturbation, sex can be touching yourself, touching somebody else. There's so many definitions of sex.
Yep.
They are
Yep.
all included and they're all important.
Yeah. And as we get older, tell us, like physiologically, anatomically, what is happening to our bodies through that sexual health lens? Like, what are the changes that happen? What can we expect? What are we feeling? What's happening?
So on a more, broad level, when we talk about menopause, so the definition of menopause is 1 year since your last period, which
Right.
isn't the best definition because not everybody knows that or has a
Yeah.
uterus or has any idea. And then you've got the perimenopause before it, which can be like up to 10 years of these gradual shifts and changes in hormone. In general, we're kind of looking at a little bit of this like chaotic shift of estrogen and progesterone when we're in perimenopause. It's kind of like a roller coaster that you maybe didn't necessarily agree to go on. And then as we get closer to menopause, it's more of a steady decline and drop in those hormones. Then in the background, unrelated, you've got a decline in testosterone, but our testosterone peaked when we were like 25, and
Okay.
then it just kind of steadily decreased. But it kind of reaches a little crossover around the menopause period where we're starting to notice, like, hey, something's going on here. Something feels
Right.
different. So, as these hormones decline, it can have big effects, basically any system of your body, which is a lot
Right.
of times why I think women going through menopause feel like they're a crazy person because they're
Mhm.
like, I got this over here and my mood and my sleep and this and that. And it's like, how is this possibly all related? Who do I go to for
Yeah.
this? And, specifically for sexual function and the pelvis and vagina, all that, vaginally and we see this decrease in blood flow,
Okay.
the tissue, the skin gets thinner. So, that friction during sex can become very like that feels like grass or glass.
Yeah.
That feels like a rug burn. That is not a
Yeah.
good feeling anymore. Decreased lubrication. The skin isn't as stretchy anymore. So, which is obviously something we need during
Yeah.
vaginal sex. It becomes a little bit less pliable.
Mhm.
Even the clitoris itself can it's not the most friendly word, but can atrophy, but it can get a little bit smaller. It can affect the pelvic floor. Estrogen is very anti-inflammatory and it
Mm.
helps muscles to repair and all those things. So your pelvic floor is a bowl of muscles. So when we have declines in these hormones, it can absolutely affect how sex feels, how we respond to touch, orgasm, all those kinds of things.
And then would that, I'm guessing, then lead to pain with sex, which then would lead to not wanting to have sex as much, which then leads to low libido, but you already have low libido because of the decreased estrogen. Like, is it just a cycle that plays on itself?
Yes, a lot of this reminds me I don't know if you ever heard of the book, like, it's like a children's book, If You Give a Mouse a Cookie, and
Oh,
it's like, if you
yes.
give a mouse
We
a
have all
cookie,
of
then
them here in our house.
he'll need a glass of milk, and then he'll need a straw, and it's just like one thing leads to another, so yes, it absolutely usually starts off with a little bit of, like, the vaginal symptoms are like, like, I'm aware of my vagina, so I'm like, "I had sex 3 days ago, and I've been aware I have a vagina for 3 days, like,
Yeah.
what is that?"
Mhm.
And that kinda gradually turns into like, "Ooh, you know, sex kinda hurt at first," or, "Now I'm burning," and now I'm hearing like, it feels like knives are going and all these things. So, huge deterrent, nothing sexy about that, and in your
Yeah.
brain starts to catch on and like, "What? Whoa, 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 what's going on here? We don't like this anymore. I don't want you to do this." So that can absolutely be a huge deterrent, but yeah, pain with sex is huge, and it is so common and I just want to scream my head off. Like I had a patient recently. She's like textbook menopause. I think she was like 49, started to have dryness, pain with sex. They gave her yeast infection medicine, even
Yeah.
though they're like, there's no infection. They gave her antibiotics, even though there's no urinary tract infection. They did a biopsy, like all this stuff. And they're like, oh, I don't know. I was like, nobody thought of vaginal estrogen.
Right.
Come on,
Right.
people.
Yes. So, all right, we're gonna segue then to vaginal estrogen. And I'll have lots of questions around that. But I do want to say, and some of you, if you've heard previous episodes, I've talked about this about a year, I would say 14 months ago. I woke up in the middle of the night and literally I felt like I had a scratch. I mean, it was very sudden, very painful, itchy, all down there in my nether regions. And I thought exactly first thing, oh my gosh, I have a yeast infection, but I know what that
Hmm.
feels like. And I'm like, I don't think this is right. Probably 3 nights in a row, I woke up and I would take the bath and I would do all the things I knew to do. And I'm like, it is not working this time around. And something clicked in me. Like, I don't know what it was, but something clicked, luckily, because I have some knowledge. And I said, oh my
Yeah.
gosh, this is decreased estrogen with the
Yeah.
running I'm doing and the friction. I think my skin is a mess. And that is when I really dove into learning about vaginal estrogen and being a breast cancer survivor. It was extra important that I do all my research. And I will say, like, I'll shout it from the mountaintops until the day that I leave this earth that vaginal estrogen has changed. Like, it was one of the most simple things to add
Hmm.
that had one of the highest effects that I've experienced. It wasn't a here, there, or a maybe.
Yep.
It was a this fixed that. Like,
Yep.
this fixed that. So why don't we dive into that first as we kind of go through some of those, things that you might offer patients who come to you. So what would vaginal estrogen do? Why don't you tell us the difference between vaginal estrogen and systemic estrogen? Because I know there are many breast cancer survivors listening. You need to know the difference. It's very important. Tell us everything we need to know.
Yeah, one of my favorite topics, by the way.
Yes, me too.
The blast at parties.
Yeah, I know, right?
Vaginal estrogen is how it sounds. It is estrogen that we put locally on the vagina, the vulva, that area, and it helps improve vaginal symptoms, vulvar symptoms in the bladder. So, very, very, very minimal systemic absorption. Where you put it is where it works. So,
Mhm.
it comes in creams, it comes in little tablets, it comes in little suppositories that dissolves, it comes in a ring, and it's fabulous for pain
Mhm.
with sex, dryness, the irritation, the feeling like you have an infection but you don't, urinary frequency, all that kind of stuff, and preventing urinary tract infections. Then systemic hormone therapy, systemic estrogen is its own category. It's the same hormone, but it is delivered differently and it is
Mhm.
delivered in an amount in a way that it affects your entire body. So, helping with hot flashes, night sweats, bone protection, heart, all those types of things. So they're very similar, but they are very different and they get categorized the same all the time. It is so
Yep.
annoying. And I will say this, as I'm sure you have before, if you have breast cancer, if you have had breast cancer, if you're at high risk for breast cancer, vaginal hormones are safe for you. I will fight your oncologist. I will fight whoever the hell, your aunt, whoever is like, that's dangerous. You shouldn't do that. No, it is not. It is one of the safest medications that exists. And
Mhm.
it's so easy.
Yes,
So
and I will
easy.
say my oncologist was A-okay with it from the get-go,
Yay.
and you guys listening, just, again, talk to who you need to talk to, but all the organizations, and we're talking about all the medical organizations, even if you go to American Breast Cancer Society, they are talking about how it is safe. Vaginal estrogen specifically is safe, and it has so many benefits long term to help with longevity and lifespan. And then, yeah, all the things that you mentioned, but I'm so glad we brought that up. So, moving again, I guess, from vaginal estrogen,
Hmm.
when someone does come to you, again, we'll back up a little bit with any of these symptoms, how do you kind of go about knowing what might be the best plan of attack, whether it's any kind of HRT or pelvic floor PT or any other things that they might need to know? Like, how would someone listening know what the symptoms are telling them and also what questions they need to be asking their own doctor?
So that is a tough question in a way because it can encompass a whole lot of things. But if we're talking pelvic pain specific, like pain with sex, again, vaginal hormones, non negotiable, that is going to help the skin so much. But if I'm hearing in their story other things, also there's constipation, there's a lot more urinary symptoms, and say we get their skin all fixed up, it doesn't burn anymore. But then we go and you can test this yourself. I test it. You put a little pressure with your finger on different
Mhm.
pelvic floor muscles. And if you're still getting a reaction,
Yeah.
I know there's some muscle dysfunction under there. And unfortunately, the longer somebody goes with genital urinary syndrome of menopause without it being treated, it turns into from just a skin
Mhm.
issue to now a skin and muscle issue.
Mhm.
Because the longer that skin is on fire, your muscles are underneath the skin, like, what the hell's going on up there,
Yep.
guys? I'm getting kind of nervous. And they clench. And over time, they learn, like, we should just stay clenched, guys, because scary things are happening. And if that goes on long enough, we need to kind of help train them. How do we relax now? It is safe now. This isn't, this can be enjoyable now.
Yep.
And, for the other symptoms, it really depends where they are in their transition, what their
Yeah.
goal is, what they're looking for. But I just generally I say to patients, lay it on me. Give me a list of all the things that are going on, even if you're like, is this crazy? Does this have anything to do with anything? Sometimes it does, and sometimes I'm like, no, that one's not me. That's something else. But we just kind of go through and make our way through it and make a plan going forward. You don't have to go in knowing exactly what's causing this symptom and what it should be treated with. Like that's
Yep.
our job.
Yep. How talk to us because I know you and guys listening, I'll have this link below too, but Andrea has an amazing Instagram. You need to go. It's super informative and very entertaining also. Like I really do love how you present information. It's very accessible, very approachable, which is really important for this subject because I will say, and I'll try not to go on a tangent, but I know from being a women's health PT and going through so much of this myself, it is an embarrassing topic, or it can be. And it has this layer of either feeling shame around it or also just assuming, oh, I'm getting older. That's a part of my life that's past. Like I shouldn't expect anything from my sexual health or my sex life anymore because of my age. And I love that we're having these conversations to be open and saying, you know what? There's still there's still pleasure available to you. You can still have a relationship in this intimate way if you choose to. You can still feel pleasure. It might take some advocacy and it might take you finding the right healthcare provider. But the fact that we're even having this conversation is so important for women, I think. And now, a quick word from our sponsors who help make this show possible. A few things for you to know about us in our home. One, I cook a lot, just about every meal at home, many times on the stovetop. Next, we like to have our kids' friends over, so that's lots of little ones running around the house. Our kids are also in school, which means all of their school germs come home with them. And we live in Colorado, which unfortunately means the past few years have been wildfire season in the summers. So, what do all those things have in common? It means the air quality in our home suffers between smells from cooking, bacteria and viruses from all of our little friends, and the wildfire smoke. The air in our home could actually be making us sick. So, our solution is the Air Doctor Air Purifier. Air Doctor's powerful 3-stage filtration captures extremely small particles. That's about 100 times smaller than what typical air purifiers can remove. It captures airborne contaminants you wouldn't want to be breathing in, such as dust, pollen, mold spores, pet dander, wildfire smoke, bacteria, viruses, odors, and more. It's also whisper quiet. I literally never hear it at all. And it has an auto mode feature, so it ensures optimal air 24/7. And even better, it has change filter reminders. So there's no more guesswork. There is nothing we have to do except turn it on and change the filter when it reminds us. Air Doctor has won Newsweek's Reader's Choice Award for Best Air Purifier, and we are so glad to have it in our own home. You can head to airdoctorpro.com and use promo code MEETYOURBODY to get up to $300 off today. Air Doctor comes with a 30-day money-back guarantee plus a 3-year warranty. That's an $84 value free. Get this exclusive podcast-only offer now at airdoctorpro.com. That's airdoctorpro.com using promo code MEETYOURBODY. And now back to our show. So with that, one thing you do talk about is ability to orgasm. So can you talk to us about that and like what the mechanism is and why that does change as we get older?
Yeah. Once you kind of go through what it takes to have an orgasm, it's kind of amazing anybody has an orgasm in the first place. It is this symphony of like, all right, we got to have enough blood flow to the clitoris and vagina and labia. We've got, pelvic floor function because you've got this muscle contraction that
Yeah.
happens with orgasm. We've got nerve endings and their transmissions. We've got neurotransmitters. It's like a bazillion different things that kind of all make up this little pie, and like I said, it's just it's amazing that anybody has one. Like, orgasms are a miracle, quite frankly, and they are a lovely miracle. And what can happen over time? Various things. So, like, let's look at the blood flow aspect. Thinking about chronic diseases some people have, like diabetes, hypertension, things like that, over time, it can affect the blood vessels. It can affect how they respond, their ability to engorge, all those things. And the blood vessels to your genitals are teeny, teeny, tiny. So it's like with erectile
Mm,
dysfunction. We always say, like, erectile dysfunction, when your penis stops working, it's like canary in the coal mine. 10 years down the road, you might have some heart disease. The little teeny tiny
mm,
blood vessels are going to have trouble first. So
mm.
again, the pelvic floor, we see so much weakness, but also tension, and a lot
Yep.
of women don't know how to access their pelvic floor. And I check
Uh-huh.
this all the time. Like, I'll ask patients to kind of squeeze their muscles around my finger and then relax them. And then I'll get like the little head pops up like, am I doing it? Am I doing
Yeah.
it? And I'm like, I want to say yes, but you're not, but that's okay because most people can't.
Yeah.
So, kind of working on muscles knowing how to relax and muscles knowing how to
Yeah.
contract is important. The nerves themselves, which I think is very interesting in the head of the clitoris. Which what was that like a year ago, 2 years ago? We only finally learned how many nerve endings there actually were in the clitoris because prior to that we were basing our knowledge on studies on cows.
Mhm.
Why study women when we can,
Right.
silly me. But there's different types of nerve endings in the head of the clitoris. The ones that respond to lighter touch, like a finger or a tongue or whatever, they're teeny, teeny, tiny, and they get damaged easier. They're kind of the
Yeah.
first ones to go and malfunction.
Mm.
But the ones that do still stick with us are tried and true are the ones that respond to deeper vibration. So a lot of times I'll hear from women, I used to orgasm from this, but now I can only orgasm from my vibrator and that
Hmm.
doesn't count. And like, yes, that absolutely counts. Whatever
Yeah.
it takes, do it. And I know change is hard. It's very hard to accept as these things happen to our body. But what is that saying? The only constant in life is change. This doesn't mean you can't anymore. It doesn't mean you can't. It's just we have to find another route around this thing.
Yes.
And I'll say there are plenty of women I also talk to. They're like, no, my orgasm's great. It's the best it's ever been.
Yeah. Yep. Yeah, because we all do respond differently, right? Like
Yeah.
hot flashes too. I mean, all these symptoms that we're taught, "Oh, you're gonna go through that, like, for you just wait." And I find we all are a little different. Like, right now, I'm feeling anxiety is a part of perimenopause. Awesome. Great.
Mm,
Okay, that's fun.
isn't
Like,
she cute?
that's super cute. It's precious. Like, so that's a little bit new, but also accepting that, like you said, our bodies are changing so drastically. Okay, I'll accept that. But also, I don't know how else my body's going to respond. Like, each day is a new day. And so I think leaving open that idea that, yeah, it might not change, or even maybe it'll get better. Like, have
Mhm.
you seen that in women that as they maybe for the first time in their life kind of explore their sexual health and what it means, are they experiencing even heightened sexual pleasure and intimacy?
Oh, yeah. Oh, yeah. A lot. And it's some of my most favorite conversations. Some of it is, I think, I would say women in menopause, they lose their bullshit tolerance, which is a fantastic, effect of menopause. That it's like
Mhm.
this realization of like, I've been through enough to know what serves me, what doesn't serve me.
Yeah.
This doesn't serve me. You can get the fuck out of my life?
Mhm.
We are only focusing on the good things here. And I see that happen with sex that women will come into me and be like, we've been doing the same thing. I haven't been honest about actually what works for me or what
Yeah.
doesn't. And I've decided that's not okay now. I also see a lot of women, like I love this story, this patient, her husband unfortunately passed away. She's in her 70s. And her good high school friend, his wife passed away. And they have now reconnected, which is just so fun to reconnect with someone from when you were younger. They're having the time of their lives. Like, she came to me
Mm.
and she's like, "I'm 70. I haven't had an orgasm. I really want to try to have an orgasm." And I was like, "All right, let's do this." So they live in the same neighborhood. At night, she gets on her bike. She brings what she calls her bag of tricks, her various like vibrators and different topicals I've given her to help increase blood flow. And she goes and they experiment. Like, they're having a fantastic time. There's no shame about,
Right.
using a vibrator, using medication. She's like, I text him and he knows when to pop his boner pill. And, we arrange it and we're having so much fun. And I'm like, yay, this is what it should be. I love this for you.
Absolutely. That is so amazing. And then with that, like it just kind of hit me being open, yes, for different things, right? Like
Hmm.
I think we have such a vision in our head of what all of this should look like, that it should either be easy or smooth or spontaneous,
Oh,
when real yes.
this
I mean you can
it's my
plan it.
I know. That's my pet peeve when everyone is sad about nothing spontaneous anymore. I'm like, okay, when you were in your 20s, every time you had sex, you absolutely knew it was you put on underwear that matched. You
Yeah.
shaved your legs, you were at school or working during the week, so you knew you were only going to see each other on, Friday or Saturday. I'm like, you knew exactly when it was coming. When is the last time that you're like, oh, that penis came out of nowhere? How did this happen? I'm like, we know. We know. Stop focusing so much on the spontaneity because it was probably never there that much.
That is a great point. No. And even when it was there, I have to say some of us didn't love the spontaneity.
No.
'Cause then it's like, "Oh, then I need to
No.
shower, and I already showered today, so can we just do this
Exactly.
later?"
I know, like, I just did my hair.
You can still do your hair and bring your bag of tricks, yes. If someone is either in a place like healthcare isn't accessible, or they're sitting at home right now and they are just not quite ready to have this conversation out loud with someone, what are some things that somebody can do at home, let's say, without all of these things that we've talked about, without necessarily going to a pelvic floor PT, without approaching medicine yet? I know for a lot of people, it takes a few steps, to get there. Are there some things people can do at home kind of right now to either help bolster themselves up or help with how they're feeling or even kind of some mental tricks to get to the place that they're ready to explore this more?
There's actually really a lot of resources online. It's not all stuff that you have to meet with somebody one on one
Yeah,
and tell your own story. Sometimes it's joining support groups or just listening, going on Reddit and seeing what people are talking about. And maybe you don't comment yet. Even looking at, websites that sell vibrators, sex devices, things like that. A lot of the people, there tends to be this thought process like, oh, you're this some weird pervert if you're selling sex
right.
toys. And it's like, no, so many amazing women are behind these companies that
Yep,
are like, I want to help educate women. I want them to have pleasure. And they're so happy to have the conversation with you of like, what are your goals? What can I help you with? Like, let me talk you through these products and I'll help you
yep,
find one that I think will work best for you. And then it arrives in a little box that nobody knows what it is. Go on your merry way. There really is a lot out there and it
yep,
doesn't have to be scary. Usually the people who are talking about it, we're not embarrassed.
yep.
We're not uncomfortable. And I know it's different being the person who has to like expose themselves and bare their soul, but like we love this stuff.
Yes, we do. We want to hear, and that's what I say to all of my clients and virtual patients. I say, I'm the, one that you should be able to tell this to. Like, I am that anonymous stranger. I'm not going to go post it anywhere. I'm not biased in this situation. Like, we want to hear it all. I want to hear everything. And then it can kind of help you guide you on where to go next. And I'll have also some links below. Like, there's even a few workouts because when you talked about being guarded, it's one thing we talk a lot about is pelvic floor here and moving because you become really guarded in the pelvis. And just that alone, if you can't move through the bones and muscles of your pelvis, like if you can't do a squat comfortably, believe it or not,
Hmm.
that is a similar position to being comfortable and open in sex. And so there's
Yeah.
some workouts, 10 minutes a day you can do to help open that up. And if you're home thinking, oh, I have a prolapse, there's no way I'm tight in my pelvic floor muscles. Nope, you absolutely can be. You'll be
Hmm.
loose in some parts and you can be tight in others. So it's worth exploring all of these different aspects
Yeah.
of what's
There's
going on down there.
Yeah, and so many tools. If you can see behind me, I've got like my little
Yeah.
dilator friends, but using dilators at home if you've got tight pelvic floor muscles, the like
Yes.
vibrating ones, you can use your thumb. You don't have to get a special tool to help relax your muscles.
Yep.
The sky's the limit on this stuff. We got a lot out
Yes.
there.
And do you have, because speaking of dilators, I'm glad you brought that up. I also wanted to ask, let's talk lubricants
Hmm.
because I know that's something else people ask about a lot and, they don't wanna go in and Google search best lubricants necessarily. Do you have either thoughts slash recommendations for lubricants if that is something if people are experiencing dryness during sex?
Yeah. And I always say, like, just because I put you on vaginal hormones or whatever doesn't mean you can throw away your lube. Two
Yeah,
different jobs. The
okay,
vaginal estrogen is something it's a maintenance drug. You're gonna be on this forever. We need it. But the lube is specifically there for the in act, the friction that we're trying to, decrease that a little bit. So
mhm.
it's not like not a good feeling. In general, there's a couple other types, but the three main types of lube, there's water-based, there's silicone-based, and then there's oil-based. So water-based tends to be the most quote unquote like natural or, maybe won't irritate your skin as much. But it also dries up the quickest and can get a little like sticky tacky, which isn't a great feeling. I really there's so many brands I like. Good Clean Love. I use slippery stuff when I'm doing in-office exams because it tends to be like very good, like non-irritating lubricant. Silicone, super slippery. Like that one is going to last, which I think is great for menopausal women. It will stain your sheets potentially, which is annoying. I think Uber Lube is a great one. You could also use it to like push down your flyaways on your hair as a second application. I always say, like, it's great to use if you're adventurous enough to be having sex in some type of water situation. However, for the love of God, it is so slippery. Like, do not get it on the floor of your bathtub or whatever.
Oh, wow.
Someone's going to break a hip.
Okay.
Someone's going down. It is slippery. And then another one I really like is oil based. I discovered this company called Coconut, and I recommend to women a lot. Like if you need kind of an in between, I'm feeling a little dry or whatever, coconut oil can be great.
Mhm.
But it's kind of awkward to have like a jar of coconut oil next to the bed and you're like digging in with your hands and is it melted yet and all that stuff. And it's very, very moisturizing. It sticks around longer than the water
Mhm.
based. And yes, that one will also stain your sheets. You know, you can't use, like if you're using condoms, you have to be careful about that. It could break them down. But
Okay.
there's there's wonderful, wonderful options out there. Lube for all. I don't care what age anyone is that comes in. I'm like, "Are you using lube?"
Yep. Tell me about and I'm not gonna say it right necessarily, so you're gonna correct me and tell us the right thing.
Okay.
DHEA
Uh-huh.
cream. I have experimented with that too, and it's funny, I did it right at the beginning of my journey with starting the vaginal estrogen also, so I was, like, flip alternating days on the 2 of them, and it just hit me the other day, I had run out of it, and I had forgotten about it
No.
and thought about it again. So tell us what that is and if you recommend it to people if it's helpful.
So the only current like FDA approved version of DHEA we have is in the form of a suppository. The brand name is called Intrarosa, but you can also get things compounded. And what is the one? Is it by Juva? I want to say
Yes, that's the
that you
one I
can,
think. Yeah.
yeah, over the counter. So it's dehydroepi and oh my god, dehydroepiandrosterone. You can just get rid of that. I'm sounding
Cool,
really
cool.
smart right now. Basically, DHEA is the parent hormone of estrogen and testosterone.
Okay.
When basically the whole vulva loves estrogen and testosterone, and estrogen always gets all the good praise. But there's this strip of skin around the opening of the vagina called the vestibule, and it is lined in hormone receptors, especially testosterone receptors.
Yeah.
So for some women, we might try vaginal estrogen out, and they're like, I feel better, but like it's not 100%. Something's still missing. So it can be really nice to add in the DHEA. And then you get a little bit of that estrogen, a little bit of that testosterone, and the skin really loves it. It's good for your clitoris too. Your
Okay.
clitoris loves testosterone as well. It's honestly one of my favorites.
Okay.
I love it. I think it's fantastic.
And do you recommend the over the counter or only the FDA approved?
I'm kinda like, we gotta meet people where they are. I
Yeah.
love the FDA approved version, but for some people, it's not covered or, even it is covered, it's too
Uh-huh.
expensive. If it was affordable to everyone, I would be prescribing that left and right.
Yeah.
Insurance coverage is getting a little bit better, but I'm kinda like, what works for you? What can we get for you? You know, and that's what we do.
Yep. And tell me the name of the one just for people listening. If they do need to go over the counter, tell me the name of that one again.
I think it's by
Julva?
Julva, or is it
Okay.
just Julva? I
I don't
haven't
know.
looked it
We
up in
should
a
look it
little
up
bit.
really quick. I'm gonna tell you guys. I think it's and I'll have the link below too. Yep, Julva. That's what it is. So it's
Okay.
JULVE, and that is the one actually I have used.
Okay. I think I was adding in another name there and giving it a new name, but yeah. No, it's a great product too. Yeah.
I would love to know. I know there are women listening to this and saying, this is all great, but I don't have a healthcare practitioner I can talk to. Or I have talked to my healthcare practitioner and they blew me off. Or they said that hormones aren't even an option for me. What would you say to those women at home really wondering, What can I do? I want to do something. I've tried. What's my next step?
First of all, I want to say I'm sorry. And it's just absolute bullshit. And I see this all the time that patients that have survived cancer and breast cancer just get cut off at the knees. Like, you're supposed to be grateful. We saved your life. That's where that ends. And
Yeah.
there's no thought to the life after that fact. And you're the person that lives in that body and lives with these side effects and experiences and all the
Mhm.
things. And you deserve everything that you want.
Yeah.
Now, if you have, if you have a clinician that initially brushes you off, honestly, some of this depends on how much mental energy you want to put into this.
Yeah.
Do you want to go back in with studies? Do you want to talk to another clinician, have an educational consultant say, like, here are some studies, this and that. Can we talk about this? I think it's not fair because it shouldn't be your job to educate somebody that went to school for this, but it's an option. And
Yeah.
I do think it helps to come from, none of us respond, even if we want to, none of us respond well to somebody coming out with blame and anger and all this, even if it is very well deserved. But if it comes from a spot of like, hey, this is actually very important to me. I really want to have this discussion where I want to be on a team with you. I'm not trying to, you know, pressure you to do something you're not comfortable prescribing, but this is important to me.
Yep.
This is what I know about it. I accept risks, this and that. Please work with me. If that's a complete dead end, or you're like, I do not have the mental energy to teach somebody how to do their job.
Yeah.
There's certainly looking different directories. So the Menopause Society web directory, sometimes you can find someone that at least has some kind of basic training on
Yeah.
menopause. There is ISWISH, which is the International Society for the Study of Women's Sexual Health. A lot of very knowledgeable providers on that list. Some clinicians have their own individual lists of practitioners as well. Like, I know Dr. Mary Claire Haver has one.
Mhm.
I believe Dr. Heather Hirsch has one. I know nurse practitioner Jackie Piasta has one. So sometimes kind of going through those little lists, and then you
Yeah.
can find someone that you're not going to have to go in there, already defeated and like, "Oh god, I just wanna feel better," but I already
Mhm.
know that I have to have this fight, and it's
Yeah.
exhausting,
Yep.
It
Yep.
is. It is.
Yep. Yep. And
I
you're
mean,
right.
I'll
It
also
takes. Oh, go ahead.
sorry, I was gonna say, I'll also say there's some online companies too,
Yep.
there's MIDI, I know Intimate Rose offers some menopause, therapy, Alloy, there's other ones, so sometimes it's a matter of going online and finding somebody
Yes.
if you can't find somebody local.
Yep. And I used Alloy for the vaginal estrogen, and I will say again, my oncologist was open to all of this,
Mhm.
but some of it was just a need for it to be easy, for it to feel easy. Like in the midst of everything the last 2 years, and like you said, you get mentally exhausted from advocating
Yeah.
for yourself. The fact that something felt a little easy was such a relief. And just know that in some of these companies, they do have health. I mean, I was paired up with a healthcare professional who is in my state, who looked at my medical background and did take into account everything that I have. And she said, yes, I'm willing to send this to you. But if you want something like this, you need to go see someone else. I want more. So it's not that they were dismissing my health
Mhm.
history whatsoever. It was the fact that it was accessible, and it was a huge breath of fresh air to me.
Yeah. I had a patient the other day and it broke my heart. Like, when the medical assistant roomed her, she was like, she seems really stressed out, really anxious.
Mhm.
And I went in and she was somebody who had breast cancer, and she came in, like, she had her list of studies. She had her this, and she was already anticipating, like, I'm going to blow her off. And it, like, I stopped her. I'm like, I can promise you, like, you don't have to say anything else. I don't care what's going on in your history. You're getting vaginal hormones before you leave this office. Like, that is happening today. And she just, like, you just saw the weight
Yeah.
lifted off, and she goes, I've been fighting for this for so long. And I'm like, ugh, it should not be that hard. It really
No.
shouldn't be.
No, and there will be things that aren't available to all of us, right?
Sure.
I mean, our health
Sure.
histories, I mean, there's so many things. There are things that won't be available to me for various reasons, but just having someone listen to my symptoms and give options, like these are
Yeah,
all the spokes on the wheel that we can address. Hormones are just one of them. And this is my answer to this. And now let's go down the line. But I'm here to
exactly.
listen, and I'm here to give you options and here to explore things because it is worth you feeling your best. And
Exactly.
I think ultimately that's what matters.
It's a conversation. That's all people are asking for is a conversation, not that immediate shutdown. Would you hear that on Instagram? Did you get it, Google MD? So that just pisses me off. Like, fuck you. You don't Google. Oh, that's what we all do. I don't know something. I go to Google. So what are we
Right.
just not supposed to be curious or ever ask any questions? Like, get out of here with
Exactly.
that shit.
Yes. You have a right to ask
Unacceptable.
questions. You have a right to get answers. And you have a right to
Yes.
feel good. You have a right to
Mm-hmm.
good, healthy sex life also. That's
Yes,
good.
you do.
Get a t-shirt that says that. Thank you so much for being here. Tell everyone how and where they can find you. And we'll have the links to all this below too.
Yes, come to my Instagram. We have fun there. It's Andrea
Mhm.
Sexplains It All with
Mhm.
little periods in between each word. Modeled after Clarissa Explains It All from the 90s kids show.
Mhm.
And then my website is Glow Health by Andrea.
Awesome. And you guys remember, if you are just looking for the kind of that educational consult, this would be a great place to start too. So check out the website. Thank you so much for being here today. I appreciate it.
Thank you. This was so fun.
I'll talk to you soon.
Bye-bye.
Thanks so much for listening today. I would love it if you could take a moment to subscribe, rate, and review this podcast. It means a lot to us and it helps our content get out to more women who need it. You can find more of my resources at my website, jessicavalant.com, or find me on YouTube at Jessica Valant and Instagram at Jessica S. Valant.